Hi, I'm Hansa Barkova, practicing pediatrician and a senior medical director at Medscape and WebMD. While gun-related violence and injury has long been a key concern for the American Academy of Pediatrics, the February 14th shooting at Marjorie Stoneham Douglas High School in Parkland, Florida, has dramatically increased national interest. I'm delighted today to be speaking with Dr. Colleen Kraft, the president of the American Academy of Pediatrics, about this issue and the AAP's efforts to advance legislative changes. Colleen, welcome.
Thank you.
So let's get to it. We've had many mass shootings in this nation, and some experts are saying that mass shootings have tripled over the last few years. What's different about this shooting? Do you think that the teen survivors from Parkland have the potential to move the needle?
When you look at any issue and you're looking at change, we hearken back to Dr. Julius Richmond's theory of social strategy change. You need your social strategy, you need your political will, and then you need the science. And these kids at Parkland have given us a new social strategy. They've come out and said, no more, enough, no gun violence. We want to be safe at school. Let's make America safe again.
Well, I think it's wonderful when the children can actually be so active and be advocates for something that's this important, don't you?
Absolutely, and we stand behind them as pediatricians because they're doing what the adults should have been doing with this issue all along.
Absolutely. Now, why does the AAP feel that gun legislation is a health issue? I'm going to be the devil's advocate here and talk from a lot of people's voices where they feel that we as pediatricians and physicians shouldn't be in this space.
So let's talk about gun safety, because gun safety is something we can all coalesce about. With our children, whether you are somebody who doesn't have guns in their homes or you're somebody who hunts to feed your children and guns have been part of your culture, we all want to keep our children safe. And what we know is that even though the mass shootings bring about all the media attention, it's the unintentional injuries, it's the homicides, it's the suicides that hurt our children at the rate of 74 deaths or injuries a day.
Wow.
If we had any illness that did that, we would have a vaccine by now. And let's keep the lens on children and safety, because we all love our children. And none of us wants to see our children hurt. And that we know that as pediatricians, we're trusted advisors to families, and that we can help to keep their kids safe, whether they are gun owners or not.
Yes, and we all want our children safe. It doesn't really matter where you live, in the cities, in the rural areas, which state you live in, but that is something that unifies us.
Correct. So.
That's absolutely correct. One study found that over 1 million kids in the U.S. live in homes with loaded and unlocked firearms. Yet many clinicians may not have the time or the expertise to educate families on gun safety. What resources does AAP offer to use in practice for these busy clinicians?
So this is a big pediatric safety issue, and this is really where the AAP is coalescing. Right now, we have on our healthychildren.org site a whole article on gun safety and violence prevention, and something that's a great resource for parents. But what don't we know about gun safety and our children? What's the impact of, for say, trigger locks on gun safety? Do parents use them? Do they help to prevent unintentional injuries? How about safe storage and gun safety cabinets? Are they used? The answer is we don't know. We haven't been able to do the research. And so the American Academy of Pediatrics, as wanting to be part of this answer, has started our Gun Safety and Violence Prevention Initiative. What we will be doing is bringing together researchers in gun safety across the United States, holding a summit, looking at what do we know in safety research, what are the gaps, and how can we use this information to further research and implement it into messages that we give to our parents and families.
That's fantastic. And what would you say to frontline physicians and caregivers? So the AP has taken such a strong interest in advocating for children, always has, and part of our job as pediatricians is to advocate for children publicly in communities, legislatively. But what would you say to the frontline physicians and caregivers to help prevent another tragedy like Parkland, who speak to families every day?
So our pediatricians are trusted by our families and our family members. And you can talk with your families about safety, but particularly with gun safety, you want to know your families, ask how they keep guns safe, know that you're supportive of what they do regardless, and that you're a trusted resource for them in keeping their kids safe from guns, from violence, from other areas that may be troublesome for them.
And as a practicing pediatrician yourself, and you've told me that you've practiced in many parts of the nation, what is the most effective way to talk to parents about this, and how have you done it yourself?
It's a great question. Much of this is knowing your families. So when I worked in southwestern Virginia, most of my families had guns in the home. So I didn't even have to ask them that. What I asked them is, how do you keep your children safe from the firearms in your home? And parents would tell me that they keep them locked, or they might not have an answer to it. But many parents came back and said, I am so glad you asked me about that.
That's great.
Because now I can tell you how I keep my children safe in our home, how we keep our firearms locked and ammunition away from where the guns are. And now I'm asking my children's friends when they go to their house, how do you keep your kids safe?
Wonderful. So you did get a lot of positive feedback. Did you ever get any negative feedback for asking the question?
I've never had negative feedback for asking the question.
Wonderful.
Because it's in the context of a trusting relationship. And our parents and families know that we really just want to keep those kids safe. We know that if they own guns, they want to prevent unintentional injuries. They want to prevent suicides and homicides just like anybody else.
Well, thank you very much for that important information, and to you and the Academy for keeping our children safe. Thank you, Dr. Kraft, for being here, and congratulations for all the work the American Academy of Pediatrics is doing in this area.
No, thank you, Hansa.